In 1910, a single report rewrote the soul of American medicine. It was less than 400 pages long. It carried no force of law. It contained no scientific discoveries, no clinical trials, no original research of any kind. But within 5 years of its publication, more than half of the medical schools in the United States and Canada had shut their doors. Within 20 years, the entire profession of plant medicine that had defined American healing for over a century had been quietly removed from the official pharmacopoeia. 10,000 pharmacists who once compounded leaves and roots and barks were retrained to count pills. The men who funded the report walked away, owning the future of medicine itself. Tonight we open the pages of the world they erased. Before we begin, take one moment to follow this channel. We tell the histories that disappeared from the textbooks, the names that were scrubbed from the records, the medicines that vanished overnight. If forgotten knowledge matters to you, you belong here. Now let us return to the year 1910. The report was titled Medical Education in the United States and Canada. Its author was Abraham Flexner. He was a former high school principal from Louisville, Kentucky. He held no medical degree of any kind. He had been hired by the Carnegie Foundation. The investigation he conducted was funded in part by the General Education Board, an organization established by John D. Rockefeller. Within the report, Flexner declared that only one model of medicine was scientific. That model was the chemical pharmaceutical model. It was based on isolated compounds, surgical intervention, and laboratory diagnostics. Every other school of healing was branded as unscientific. Every other school of healing was branded as unworthy of funding. Every other school of healing was branded as unfit to exist. The schools that trained doctors in plant medicine were called eclectic schools. There were dozens of them across the country. Some had been operating for over 70 years. They had thousands of graduates. They had their own peer-reviewed journals. They had their own pharmacopoeias. By 1935, every single one of them was gone. The textbooks they used were pulled from libraries. The herbal monographs they had refined for generations were removed from the United States Pharmacopoeia, and the 10 healing plants we are about to discuss were among the most common medicines on every shelf in every drugstore in America. Tonight we will name them. We will name what they were used for, and we will name what was lost when they vanished. Number 1. Lobelia inflata. It was called Indian tobacco by the colonists, and it was called pukeweed by the doctors who watched it work. The plant grew wild across the eastern half of North America. The Cherokee and the Iroquois had used it for centuries before the first English settler set foot on the continent. Its small blue flowers concealed one of the most powerful respiratory medicines ever discovered. In the 1800s, it became the central pillar of an entire school of American medicine called Thomsonian herbalism. Samuel Thompson, a New Hampshire farmer with no formal training, built a national following around this single plant. He treated asthma, he treated whooping cough, he treated pneumonia, he treated croup. He treated cases of suffocation that no other physician could resolve. The records of his practice describe children turning blue from lack of air who were given a single dose of Lobelia tincture and began breathing freely within minutes. The plant contains an alkaloid called lobeline. Lobeline binds to the same receptors in the human body that nicotine binds to. It stimulates breathing. It relaxes the muscles surrounding the airways. It triggers the body to expel mucus and obstruction from the lungs. By 1890, it was carried by every well-stocked American pharmacy in the form of fluid extracts, tinctures, and dried leaf. By 1937, it had been removed from the United States Pharmacopoeia. By 1993, the Food and Drug Administration had classified it as a poisonous plant and warned the public against its use. Today there are inhalers that cost thousands of dollars over a lifetime for the same condition the Lobelia plant treated for the price of a few cents. The plant still grows wild. It is still legal to harvest in most states. But almost no one alive today remembers how to use it. Number 2. Black cohosh, Simicafuga racemosa. The plant has tall white feathery flowers and a thick dark root that smells of damp earth. The Algonquin peoples called it squaw root because the women of the tribe used it for every condition that affected the female body. The colonists adopted it within decades of arrival. By the early 1800s, it had become the most widely prescribed remedy for menstrual disturbances in the entire United States. It was the standard treatment for painful periods. It was the standard treatment for menopause. It was the standard treatment for difficult childbirth. It was the standard treatment for what the physicians of the day called nervous prostration in women. The eclectic doctors of the 1800s documented thousands of cases in their journals. They described women who had suffered for years with debilitating cramps becoming entirely free of symptoms after a few weeks of black cohosh tincture. They described the relief of hot flashes during the change of life. They described the gentle regulation of menstrual cycles that had been irregular since adolescence. The active compounds in the root act upon estrogen receptors and upon the hypothalamic pituitary axis. Modern research has confirmed every one of the original eclectic indications, and yet after the Flexner report the plant was deemed unscientific. It was removed from the United States Pharmacopoeia in 1926. The women who had relied on it for generations were prescribed synthetic estrogens instead. Those synthetic estrogens would later be shown to dramatically increase the risk of breast cancer, stroke, and cardiovascular disease. The black cohosh plant still grows wild in the forests of Appalachia. The roots can still be harvested in autumn. The tincture can still be made at home in any kitchen with a clean jar and a bottle of grain alcohol. But the knowledge of how to use it correctly was systematically erased from every medical school in the country. Number 3. Golden seal, Hydrastis canadensis. A small woodland plant with a single forked stem, 2 large leaves, and a brilliant yellow root that stained the fingers of anyone who handled it. The Cherokee used it as a wound wash. The Iroquois used it for sore eyes. The early American settlers learned its uses from the indigenous healers and within a generation had elevated it to one of the most valuable medicinal herbs on the continent. By the 1870s, wild golden seal was being harvested in such enormous quantities that it had begun to disappear from the forest where it had grown for thousands of years. Pharmacies sold it in the form of tincture, fluid, extract, powdered root, and prepared salve. It was prescribed for every infection of mucous membrane in the human body: sore throats, sinus inflammation, conjunctivitis, mouth ulcers, stomach ulcers, intestinal infection, urinary infection. The plant contains an alkaloid called berberine. Berberine is now known to be one of the most powerful natural antimicrobial compounds ever identified. It has been shown in modern laboratory studies to kill bacteria, fungi, and parasites at concentrations that rival pharmaceutical antibiotics. It also lowers blood sugar, it also lowers cholesterol, it also improves insulin sensitivity. In 1910, golden seal was a standard household medicine. By 1960, it had been removed from the pharmacopoeia. In 2010, berberine became one of the most studied compounds in natural medicine, and yet almost no American doctor was permitted to prescribe it. The yellow root that grew quietly in the shaded woods of the eastern United States held the answer to a dozen modern conditions, but the knowledge of how to find it, how to harvest it, and how to prepare it had been removed from the curriculum of every medical school in the country 100 years before. Number 4. Echinacea, the purple coneflower of the American prairie. The Plains tribes had used it for more conditions than any other plant in their pharmacopoeia. The Lakota, the Cheyenne, the Pawnee, the Omaha, the Crow, all of them carried dried Echinacea root with them on long journeys. They used it for snakebite. They used it for spider bite. They used it for infected wounds. They used it for toothache. They used it for sore throat. They used it for the early stages of every fever. The plant was introduced to white American medicine in 1887 by a Nebraska physician named Henry Meyer. Within 15 years, it had become the single most prescribed herb in the eclectic pharmacopoeia. The Lloyd Brothers Pharmaceutical Company of Cincinnati, Ohio, sold more Echinacea preparation than any other product in their catalogue. Doctors used it as a blood purifier, as an immune stimulant, and as a treatment for systemic infection in an era before antibiotics existed. The plant contains polysaccharides and alkylamides that have been shown in modern research to activate the human immune system in measurable ways. It increases white blood cell production. It enhances macrophage activity. It shortens the duration of viral infections. In 1910, Echinacea was a household name. After the Flexner report, it was branded as unscientific and removed from the pharmacopoeia. The Lloyd Brothers Laboratory in Cincinnati was eventually shut down. The Eclectic Medical School of Cincinnati, which had trained thousands of doctors in the use of Echinacea, was closed forever in 1939. The plant still grows wild across the American prairie. The root can still be dug in autumn after the first frost. The tincture is still made by a handful of small herbalists today, but the conventional medicine that replaced it offers nothing comparable for the conditions Echinacea once treated. Number 5. Bloodroot, Sanguinaria canadensis. The plant emerges from the forest floor in early spring with a single white flower and a thick rhizome that bleeds red when cut. The Algonquin peoples used the red sap as a body paint and as a medicine for respiratory ailments. The settlers learned that the plant had a profound effect on the lungs. By the 1800s, it had become a standard treatment for chronic bronchitis, asthma, and persistent cough, but it was the external use of bloodroot that would become its most controversial application. The plant contains an alkaloid called sanguinarine. Sanguinarine has a remarkable affinity for abnormal tissue. When applied as a paste to skin growths, it draws them out of the body. The eclectic physicians of the 1800s documented hundreds of cases of skin tumours being eliminated by bloodroot paste, which became known in those decades as black salve. The procedure was used by the doctors of the day to treat lesions that conventional surgery could not reach. After the Flexner report, this entire branch of dermatological treatment was abandoned by mainstream medicine. By 1960, bloodroot had been removed from the pharmacopoeia entirely. The Food and Drug Administration would eventually classify any topical preparation containing bloodroot as a dangerous and unapproved drug. Those who continued to manufacture it were prosecuted. Those who continued to use it were warned of severe legal consequences. The plant itself still grows in every shaded woodland of the eastern United States. The red root is still gathered every spring by a handful of remaining traditional herbalists. The knowledge of how to prepare it correctly, how to dose it safely, and how to read the response of the body to it has been almost entirely erased from the medical record of the country that once relied on it. Number 6. Pleurisy root, Asclepias tuberosa, the orange-flowered milkweed of the dry American meadow. The Iroquois had used the plant for chest pain and breathing difficulty long before the arrival of European settlers. The eclectic physicians of the 1800s elevated it to one of the most important respiratory medicines in their entire pharmacopoeia. It was the standard remedy for pleurisy, the painful inflammation of the lining of the lungs that was once one of the most common and deadly complications of pneumonia. It was also used for pericarditis, bronchitis, influenza, and every form of dry, painful cough. The root contains compounds that act upon the bronchial system. They reduce inflammation, they thin mucus, they promote sweating, they lower fever, they ease the sharp stabbing pain that characterizes inflammation of the pleural membrane. In the years before antibiotics, pneumonia was a leading cause of death in the United States. The eclectic physicians treated thousands of cases with pleurisy root tincture in combination with other plant medicines and reported survival rates that compared favorably with any other treatment then available. After the Flexner report, the entire approach was abandoned. By 1960, pleurisy root had been removed from the United States pharmacopoeia. By 1995, it was almost impossible to find a single American physician who had ever heard of it. The plant still grows in the dry, sunny fields of the eastern and central United States. The orange flowers bloom in midsummer. The thick taproot is gathered in autumn. The tincture is still prepared by a small number of dedicated herbalists who learned the practice from grandparents who had learned it from grandparents in the years before 1910. Number 7. American mayapple, Podophyllum peltatum. The plant carpets the forest floors of the eastern United States every spring with its umbrella-shaped leaves and small white flowers. The Cherokee had used the root for centuries as a powerful purgative and as a treatment for skin growths and warts. The settlers learned its uses from the indigenous healers, and the eclectic physicians of the 1800s developed it into one of the most sophisticated plant medicines in their entire pharmacopoeia. They used it for chronic liver congestion. They used it for stubborn constipation. They used it for skin conditions. They used it as a topical treatment for tumours and abnormal growths. The plant contains a compound called podophyllitoxin. Podophyllitoxin would eventually become one of the most important chemotherapy drugs in modern oncology. It is the precursor compound for etoposide and teniposide, both of which are still used today in the treatment of testicular cancer, lung cancer, and lymphoma. The pharmaceutical industry has built billion-dollar revenues on derivatives of this one plant, and yet the original whole plant medicine, the one that had been used by American doctors for over 100 years, was removed from the pharmacopoeia and forgotten. By 1970, mayapple was no longer a household medicine. By 1990, it was unknown to almost every practicing physician in the country. The plant still grows in vast colonies across the woodlands of the eastern United States. The roots can still be gathered, the compounds can still be prepared, but the knowledge that once allowed an American family doctor to treat conditions that now require oncology specialists has been almost entirely erased from the public mind. Number 8. Boneset, Eupatorium perfoliatum. The plant grows in damp meadows and along stream banks across the eastern half of the United States. Its narrow leaves wrap around the stem in a way that gave it its common name, because the early settlers believed the plant could mend bones if a poultice was applied. In truth, the name had a different origin. The plant was the standard treatment for a disease once called breakbone fever, which we now know as dengue, or as a particularly severe form of influenza that caused such intense aches in the joints that patients felt their bones were breaking. Boneset relieved that pain. Boneset broke the fever. Boneset triggered profuse sweating that cleared the infection. The plant became one of the most important household medicines in 19th century America. Every farmhouse in the eastern half of the country kept a bundle of dried boneset hanging from the rafters of the kitchen. When the fevers of autumn came, when the influenza of winter came, when any infection accompanied by deep body aches arose, the bundle was taken down and a strong tea was brewed. The plant contains compounds that stimulate immune response, that reduce inflammation, that lower fever, and that ease the muscle and joint pain of viral illness. In 1918, when the great influenza pandemic killed 50 million people worldwide, Boneset was one of the most widely used treatments in rural America. After the Flexner report, it was steadily phased out of medical education. By 1950, it had been removed from the pharmacopoeia. By 2000, it was known only to a handful of traditional herbalists. The plant still grows where it has always grown. The flowers still bloom in late summer. The leaves are still gathered, but almost no one in modern America knows what to do with them. Number 9. Cannabis indica. The plant has a history in American medicine that has been so thoroughly erased that most citizens of the United States today do not believe it ever happened. From 1850 until 1942, cannabis was listed in the United States Pharmacopoeia as an official medicine of the federal government. It was prescribed for migraine headaches. It was prescribed for menstrual cramps. It was prescribed for the pain of childbirth. It was prescribed for insomnia. It was prescribed for chronic neuralgia. It was prescribed for the early stages of every condition that we now call anxiety disorder. The major pharmaceutical companies of the late 19th century all manufactured cannabis preparations. Eli Lilly, Park Davis, Squibb, Smith Brothers. All of them sold tinctures, fluid extracts, and prepared compounds containing cannabis indica imported from India and grown domestically in Kentucky and Vermont. The eclectic physicians of the 1800s wrote extensively about its uses. They reported relief of conditions that no other medicine of the era could address. They reported the gentle restoration of sleep in patients who had not slept properly for years. After the Flexner report, cannabis was steadily restricted. In 1937, the Marijuana Tax Act effectively criminalized its medical use. In 1942, it was removed from the United States Pharmacopoeia. The pharmaceutical industry pivoted to synthetic alternatives that were more profitable, more patentable, and far more dangerous. Millions of American patients who had once relied on cannabis tincture for migraine or sleep or pain were now prescribed barbiturates, opioids, and the early generations of synthetic sedatives. The plant itself was banned. Possession became a federal crime. The historical record of its medical use was suppressed in the public consciousness for almost 3 generations. And number 10, Stillingia sylvatica, the queen's root of the American southeast, a tall, slender plant with milky sap, and a thick yellow root that grew in the sandy soils of the Carolinas, Georgia, Alabama, and Florida. The Cherokee, the Creek, and the Seminole all used it as a blood purifier and as a treatment for chronic skin conditions, glandular swellings, and the kind of deep tissue infections that no other plant could reach. The eclectic physicians of the 1800s adopted it enthusiastically. They used it for syphilis in an age before antibiotics. They used it for scrofula, the tuberculosis of the lymph nodes that affected so many children in the crowded cities of the 19th century. They used it for chronic eczema. They used it for ulcerations that would not heal. They used it for the lingering aftermath of severe infectious illness. The root contains ditapene compounds and complex alkaloids that have been shown in modern preliminary research to have immune-modulating and antimicrobial effects. The Lloyd Brothers Laboratory in Cincinnati produced fluid extract of Stillingia as one of their flagship products for over 50 years. After the Flexner report, Stillingia disappeared from the pharmacopoeia almost entirely. By 1960, no American medical school taught its use. By 2000, it was so obscure that even most professional herbalists had never heard of it. The plant still grows in the sandy pine woods of the Deep South. The roots can still be dug in late autumn. The traditional preparations can still be made by anyone who knows the old methods. But the conventional medicine that replaced it has nothing equivalent to offer for the conditions Stillingia once treated. And the patients who suffer from those conditions today are simply told that no effective treatment exists. These 10 plants were not the entirety of the eclectic pharmacopoeia. They were not even the most important. They were simply 10 among hundreds that disappeared from American medicine in the span of a single generation. The full list runs to over 500 plants. Each one had been studied. Each one had been documented. Each one had been refined into specific preparations for specific conditions by generations of working physicians. The eclectic medical schools had produced their own pharmacopoeias that ran to more than 1,000 pages. The Lloyd Brothers Laboratory in Cincinnati had archived more than 10,000 original herbal monographs. After the Flexner report, all of it was systematically removed from the curriculum of American medical education. The mechanism was not violent. It did not need to be. It was financial. The Carnegie Foundation and the General Education Board offered massive grants to medical schools that adopted the new pharmaceutical model. They withheld funding from any school that continued to teach plant medicine. Within a decade, the choice for any medical school in the country was clear. Conform to the new model and receive the money. Resist and be slowly starved out of existence. The eclectic schools resisted. The homeopathic schools resisted. The naturopathic schools resisted. One by one they collapsed. Their libraries were dispersed. Their journals were discontinued. Their graduates aged and died without successors. By 1940, the entire profession of plant medicine that had defined American healing for over 100 years had been removed from public memory. Before the great erasure was complete, a small group of men attempted to preserve what was being lost. John Uri Lloyd of Cincinnati was a chemist and a pharmacist who had spent his entire career documenting the plant medicines of the eclectic tradition. With his brother, Curtis Gates Lloyd, he established a private library in Cincinnati that eventually contained over 200,000 volumes on botany, pharmacy, and natural medicine. The Lloyd Library still stands today on Plum Street in downtown Cincinnati. It is one of the largest private collections of herbal medical knowledge in the world. Most Americans have never heard of it. Harvey Wicks Felter, who edited the King's American Dispensatory of 1905, devoted the final decades of his life to making sure the complete record of eclectic plant medicine would survive the institutional collapse he could see coming. John King himself had begun the dispensatory in 1854. By the time Felter completed the final edition, the work ran to over 2,000 pages and described the medicinal uses of more than 900 plants in extraordinary detail. The dispensatory is still in print. It is the closest thing we have to a complete map of the lost American pharmacopoeia. The men who wrote it knew exactly what was being taken from the country. They worked against time. They worked against funding. They worked against the institutional weight of the foundations that were dismantling their world. And they succeeded in preserving the record, even as they failed to preserve the profession. The men who funded the report did not hide their motivations. John D. Rockefeller had built the largest fortune in American history on the petroleum industry. The pharmaceutical products that replaced plant medicines were derived almost entirely from petroleum byproducts, coal tar, synthetic organic chemistry. The new drugs were patentable. The old herbs were not. The new drugs required centralized manufacturing. The old herbs could be grown in any backyard. The new drugs generated returns that could be measured in billions. The old herbs generated returns that could be measured in pennies. What was lost in the transition was more than a list of medicines. What was lost was a way of looking at the human body. The eclectic physicians did not treat symptoms in isolation. They treated the constitution, they treated the terrain, they treated the underlying balance of the organism. They believed that disease was the result of accumulated stress upon the system, and that healing came from supporting the body's own capacity to restore itself. Plants were the tools, the body was the healer, the doctor was the guide. The 10 plants we have named tonight still grow in the fields and forests of the United States. They have not vanished from the earth. They have only vanished from the textbooks. They can still be identified. They can still be gathered. They can still be prepared. And they can still be used by anyone willing to learn the old methods that were almost completely erased from the country that once depended on them. What was forgotten can be remembered. What was erased can be recovered. The pharmacopoeia of 1910 still exists. The eclectic dispensatories are still in print. The Lloyd Brothers archives are still preserved. The knowledge that was driven underground by one report 100 years ago is now being rediscovered by a generation of people who never accepted that the only medicine worth having came in a sealed bottle from a corporate laboratory. The plants are still here. The question is whether we are willing to remember them. Thank you for being here tonight. If this history matters to you, share it with someone who needs to know. The record survived. The plants survived. And as long as we keep telling these stories, the knowledge survives too. Until our next journey into the world that was, take care of yourselves and remember that what was once known can be known again.